Okay. My name is Rainey. I'm doing a head-to-toe assessment on my patient here. Can you tell me where you are, your name, and what day it is?
Lori, I'm at the clinic and it's Thursday.
Okay, she's alert and oriented to person, place, and time. And I'm going to say 3 words. Can you repeat them? Banana, sunrise, chair.
Banana, sunrise, chair.
So her mental status is not altered, and her mood is appropriate to the situation, appropriate affect, and she demonstrates that her hearing and speech is normal by responding to my verbal commands and my questions. And I'm looking at her right now, just general survey. Skin looks good. I don't see any redness, any swelling, or any open areas from this view. I'm looking at her hygiene. Hair is clean. I don't see smell and odor. And her clothes are appropriate to the situation and they're not wrinkled. And I'm going to just start with her face. So I'm looking at the skin on her face. It's intact, no swelling, no redness, and temperature is warm and it's elastic, the turgor. And I'm going to first palpate her temporal arteries, and the pulse is easily palpable, regular rate and rhythm, smooth upstroke, 2+ pulse, and maxillary sinuses, any pain when I press there?
No.
Frontal sinuses, any pain there?
No.
Okay. And then I'm going to have her close your eyes, squeeze them tightly, and I'm going to try and open them. Okay? Puff out your cheeks, purse your lips and blow out air. Smile with your teeth clenched. Okay? Raise your eyebrows. Okay, so all of those movements she did, her facial structure, they're symmetrical. That demonstrates that the facial cranial nerve is intact. And then I'm going to look at her eyes, her eyelids. The skin is intact, no redness, no swelling, no drainage. A full closure of her eyelids. The margins are pink, and they are bilaterally equal. And so I'm putting on gloves for this, and I'm going to pull open her eye and have her look up. And I'm looking at the sclera. It's white, clear, and shiny. And then I'm everting the bottom lid, and you can look down. I'm looking at the conjunctiva, and it's pink in color, no redness, no drainage. It's shiny and moist. And the cornea. So I need my pen, which is in my pocket here, my pen light. So I'm looking at her cornea here, and it is clear, transparent, and her iris is round, and the color is consistent, and her pupils are round, equal, and reactive to light, and they have a consensual reaction and accommodation. And then they're about 2 millimeters in size. And then I'm looking at her eyelashes. Those are slightly curled and evenly distributed. And so then we will move on to we'll test her visual acuity using the Snellen chart. Okay, so I'm going to have you read the smallest line that you can.
63925 ME backwards E.
Okay, so that is 20/20 vision, and she's not wearing any corrective lenses or contacts. Then we will do the corneal light reflex, and I'm going to hold this about 12 inches from her face, and I'm going to shine it directly at her nose, and I'm looking at the light reflection in her eye. It's bilaterally equal. All right, and then we will do the and then that demonstrates the abducens, the trochlear, and the ocular motor nerve are intact. I'm going to do the corneal light reflex. And I'm going to dim the lights for this. And I'm standing with this light about a 15-degree angle from her lateral vision, and I'm just moving in and looking for the red glow over her pupil. And I can see a red glow on both sides, bilaterally equal, and the red glow, as I move in closer, it doesn't go away, it stays there. So, I'm just going to put on this to get that part. Okay, then we're going to do the, I'm going to have her stand up, we'll do the confrontation test. Okay, so I'm going to have you cover your eye with this, and I'm going to cover my eye. And I'm just going to tell you when you can see, or you tell me when you can see my finger in your peripheral vision.
No. 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 No.
Okay, that demonstrates that her optic nerve is intact. We would do that with the other eye as well. And then we're going to do the 6 cardinal fields of gaze, so I'll have you stand back up. And I just want you to follow my finger with your eyeballs, don't move your head. Okay, so that's the 6 cardinal fields of gaze. And then I'm going to look in her, we'll do the ears. Actually, no, nose, moving to the nose. Okay, so, grab everything, like that. Okay, so I'm looking at her nose right now. The structure is midline. The skin is intact, no redness, no swelling, no drainage. The nares are bilaterally equal. There's no flaring. I'm going to look inside her nose here. And I'm looking at the nasal mucosa, which is red in color. The turbinates are a deep pink, and the septum is midline, and it's bilaterally symmetric. No open areas, no redness, no drainage. And then I'm going to test the patency of her nostrils. So I'm going to have you close your mouth and plug one nostril and sniff in. Okay, and that's a free exchange of air, no noises. So that demonstrates the patency of the nostril. Then I'm going to have you close your eyes, plug one nostril, and smell this. What is that?
Coffee.
So she identified the smell correctly, so that demonstrates the olfactory nerve is intact. Okay, so that was everything with the nose. Then I'm looking at the mouth. First thing I'm going to do is the temporomandibular jaw. So I'm placing my 2 fingers in front of her ear. I'm going to have you open and close slowly. Move your bottom jaw side to side. Any pain?
No.
Okay, and those were smooth movements. There was no clicks when she opened or moved her jaw. She said no pain. Then I'm going to look at her lips from the outside. They're vertically and laterally symmetric. They are intact, no dry spots, moist. Then I'm going to put on my gloves because I'm going to look at the inside of her mouth. So I'm going to start with I have my pen light here in case I need it. And then I'm starting with the buccal mucosa, so it's shiny, red, intact, and no open areas or redness. Then I'm looking at her gums, and there's no red areas. They're pink, shiny, no open areas, no swelling. Her teeth, they are no broken ones, no loose ones, and no missing teeth. Okay, I'll have you close your teeth. The alignment is normal. Top teeth are slightly over the bottom. Okay, you can open up again here. And I'm going to have you stick out your tongue and towards your nose, towards your chin, side to side. And so the smooth forward thrust of her tongue demonstrates that the hypoglossal nerve is intact. Okay, so I'm still wearing my gloves. I'm going to have you open up again. And I'm using my pen light to look at the anterior and posterior pillars. They're pink in color, shiny, no open areas, no swelling. The hard palate has irregular transverse rugae, and the soft palate is shiny, pink, no open areas, no swelling. The posterior pharynx is pink, no open areas, no swelling. The tonsils they have an irregular surface with some craters, but no drainage, no swelling, no open areas, no drainage in those craters. And then the uvula, that comes down midline from the soft palate, and we're going to test her vagus nerve here. So I'm going to use the tongue blade here, and I'm going to have you say ah. So her soft palate moves slightly upward, and the uvula stays midline. That demonstrates the vagus nerve is intact. Then I'm going to have you open up again. I'm going to touch the posterior pharynx with my tongue blade. And the patient momentarily gags. That demonstrates that the glossopharyngeal nerve is intact. Okay, so that's everything for the mouth. Then I'm going to move to the ears.
Stand or sit?
You can sit, that's fine. So I'm looking at the external ear. I don't see any drainage from the outside. It's intact, no redness, no swelling. Any pain when I touch your ear?
No.
No pain, okay. Then I'm going to use the otoscope to look in the ear. And just small amounts of cerumen, yellow in color, moist. No foreign bodies, no open areas, no redness in there, no drainage. Any pain in there?
No.
Okay, and do the same for the other ear. And then we will do the Renee test. Okay, so I'm gonna use the tuning fork here, and I'm gonna place the fork end on the mastoid process. And tell me when the vibration stops.
Stop.
Okay, and now I'm gonna point the other end towards the front of her ear. Tell me when the vibration stops.
Stop. Took longer.
Okay, so it took 2 times as long for her to stop hearing vibration in the front, and that's normal. Now we'll do the Weber test. All right, and which ear could you hear it more in?
I heard it equally in my ears.
Equal in both ears? Okay. So we did Weber, Renee, the otoscope. Okay, whisper test. So I'm going to cover my mouth so you can't read my lips, and I'm going to say 3 words, and I want you to repeat them. Ball, cat, car.
Ball, cat, car.
Okay, I'm going to say 3 more 2-syllable words, and I'll have you repeat them. High chair, streetcar, baseball.
High chair, streetcar, and baseball.
Okay, so she repeated all of those words. That was the whisper test. So now I'm going to move on to her head. So I'm just looking at her hair. It's clean, shiny, looks healthy. I don't see any dry skin, dermatitis, any pain when I palpate your scalp.
No.
I don't feel any bulges or depressions. The skull is, or the cranium is round, it's symmetric, and yeah, no bulges or depressions there. And no pain when I palpate.
No.
Okay, so then we're going to, so I'm going to have you sit on this because we'll do your neck.
Okay.
Okay, so right now I'm just looking at the skin on the patient's neck. There's no open areas, and temperature is warm. The skin is elastic, no redness, no swelling. We're going to palpate the thyroid. So I'm going to use my 2 fingers here standing behind her. I'm going to push it to the left to feel the right side. Can you swallow?
Mm-hmm.
Push it to the right to feel the left side. Can you swallow? Any pain?
No.
Tenderness? Okay. I can't, the thyroid gland is not palpable. I don't feel any nodes, nodules, or masses. Then I'm going to come to the front here, and I'm going to place both thumbs on the side of the trachea here. Any pain or tenderness?
No.
The trachea is midline. Okay, and then I'm going to palpate the carotid artery, each side separately. The pulse is palpable, regular rate and rhythm. Same with the other side. Then I'm going to listen for the carotid bruit with the bell of the stethoscope. I'm going to have you hold your breath. No carotid bruits heard, that's good. And then we're going to do range of motion. So hyperextension, I'm going to have you put your neck back as far as you can. Flexion forward as far as you can. And then lateral flexion to the right. No, not turn, you're not doing rotation, just turn it like this, or bend it. And then lateral flexion to the left. And then we'll do the rotation. So look to your right and then look to your left. Any pain with that?
No.
Okay, range of motion was good. And then I'm going to test her spinal accessory nerve by testing the strength of her trapezoid and sternocleidomastoid muscles. So I'm going to push down on your shoulders and you're going to shrug up. Okay, if she's able to withstand the resistance I place on her shoulders, that demonstrates the spinal accessory nerve. And then we'll test the sternocleidomastoid. I'm going to put my hand on your cheek and you try and push it. And I'm watching the sternocleidomastoid muscle on the other side. I can see it contract. And when I do it on the other side, I can see it contract, and it contracts equally, and the strength is good. Okay, so then I'm going to move, so I'm going to do the jugular vein when you lay down. Now I'm looking at your chest here. I'm watching for the movements as you breathe. There's no retractions, and with each breath, the chest is bilaterally symmetrical moving. And then I'm going to palpate for the thoracic expansion. So I'm going to place my hands on the patient's chest like this, and I'm going to have you take a deep breath. And upon inspiration, my thumbs move laterally outward, bilaterally equal. And then I'm going to do tactile fremitus. So I'm going to place my hands on your chest again, and you're going to say 99.
99, 99, 99.
Okay, and I can feel the fremitus equal on each side. I was comparing sides. That demonstrates the lung density. Then I'm going to palpate the apical pulse, the point of maximal impulse, and that is in the 5th intercostal space, left mid-clavicular line. And I palpate that for 30 seconds and regular rate and rhythm, easily palpable. Then we will listen to the, in each intercostal space, the 5 intercostal space with the bell and the diaphragm. So the first one is the 2nd intercostal space, right sternal border, that is the aortic valve and bell diaphragm. And the other one is 2nd intercostal space, left sternal border, that is the pulmonic valve and diaphragm and bell. Then the 3rd intercostal space, left sternal border, is Erb's point, and I'm listening with bell and diaphragm. And 4th intercostal space is the tricuspid valve and left sternal border, and I'm listening with bell and diaphragm. And then the last is the mitral valve, or the apical pulse, and that is the 5th intercostal space in the left mid-clavicular side. And for that one, I'm listening with the diaphragm for a full 30 seconds. And then I'm also listening with the bell. And all those pulses were regular rate and rhythm, 2+ pulse, smooth upstroke. And then I'm going to, listen to the breath sounds in 8 space on her anterior chest, 8 landmarks. Breathe in, out, in, out. Okay. And breath sounds were normal, no wheezing, cracking, rails, and the vesicular breath sounds were heard in the periphery of the lungs. The bronchiovesicular were heard over the bronchial in the middle, the bronchioles, and then the bronchial breath sounds were heard around the trachea. So then I'm going to do indirect percussion, and I'll do it in each intercostal space, starting at the top and working my way down. And it is a resonant tone, hollow in quality, long in duration, and low in pitch. Okay, then I am going to, while I have the patient in this position, okay, so we did percussion, palpation, I think that's everything for the front. While I have her in this position, we will also do the shoulder range of motion and shoulder strength, elbows, upper extremities. So I'm going to have you put your arms down at your sides and lift them up beside your ears. That's flexion of the shoulders. Any pain with that?
No.
Okay, so back down and then behind. Hyperextension of the shoulders. Any pain?
No.
And abduction of the shoulders is out to your sides.
Oh.
Like, go like this. And then adduction is across the front. Any pain with those movements?
No.
Okay, and then external rotation, you're going to point your elbow out and put your palm on the back of your head. No, that's the internal. External rotation. And then internal rotation is the back of your hand on the small of your back. Any pain with either of those movements?
No.
Okay. Then I'm going to test the strength of your shoulders. So I'll have you hold them out in front of you like this, and I'm going to try and push down, and you withstand my resistance. Okay, that's equal muscle strength on each side. Then we're going to do range of motion of your elbows. So for that, I'm going to have you flex your elbow, extend your elbow, okay, and then put your arms out like this. And then supination is turning them up, and then pronation is down. Any pain with those range of motions?
No.
Okay, then we'll do your wrists. So bend your wrist down, that's flexion. Bend your wrist up, hyperextension. Ulnar deviation is point your wrists outward. And radial deviation is point them inwards. Any pain with those movements?
No.
Okay, and then we're testing the strength of the wrists. So I'm going to have you bend them down, flexion, and I'm going to try and extend them. I'm not able to. Equal strength in both sides. Then I'm going to have you hyperextend them, your wrists, and I'm going to try and push them down. I'm not able to. She can withstand resistance and equal strength on both sides. Then we'll do flexion of your fingers. So flex your fingers and hyperextend. Point them up and fist, and then abduct them, spread them apart. Any pain with any of those movements?
No.
And was there any pain with the ones in your wrists?
No.
Okay, then I'm going to do the strength of your fingers. So I'm going to have you put them out again, and you're abducting them. I'm going to try and push them together. She's able to withstand resistance. Then I'm going to have you flex your fingers, and I'm unable to pull them up or extend them. Then I'm going to have you hyperextend them, so try and point them up, yep, and I'll try and push them down. And I'm not able to push her fingers down, so that's equal strength in both hands. And then we'll do her grasp, so I'm going to have her grasp my 2 fingers with each hand. She has a strong equal grasp and she fully flexes the fingers. Okay, and then we will do the brachial pulse. I'm going to palpate the brachial pulse here, and regular rate and rhythm. I'm going to palpate the radial pulse here. It's a regular rate and rhythm, and the lymph node, the axillary lymph nodes. So patient's arm is relaxed. I'm going to kind of hold it out here, and I'm going to be palpating deep into her armpit and down the side of the chest wall. Any pain there?
No.
I don't feel any lymph nodes, any masses. Okay, and then we're going to do the deep tendon reflex. The biceps we'll do first. This is an indirect one. I use the point of the hammer to hit my finger.
Yeah.
And then, okay, so that demonstrates a 2+ reflex. The bicep contracts. Hand is going to be pretty much in the same position here to do her tricep one, except this is a direct on the tendon. And that causes contraction of the tricep muscle. It's a 2+ reflex. Then the brachial radialis tendon reflex. This also goes directly on the tendon, and it causes, pronation of the elbow and flexion of the muscle. And that's a 2+ deep tendon reflex as well. Then we're going to do, okay, then we're going to do the 2-point discrimination. So close your eyes. Tell me how many pokes you feel on you.
2.
Okay, that's the 2-point discrimination. And I'm going to keep your eyes closed. I'm going to put something in your hand. Tell me what it is.
A coin.
Okay, that's the stereognosis. And then the graphesthesia. She's keeping her eyes closed. I'm drawing something on her hand. She's going to tell me what it is.
An S.
Okay, and then we're going to do the sensations here. So you'll feel sensation, and I want you to tell me what kind of sensation it is.
Vibrating.
And tell me when it stops.
No.
Okay, that was the vibration sensation. And I want you to tell me, I'm going to rub something on your body. Tell me where you feel it.
On my arm.
That was the light touch sensation. And now we're going to do the sharp pain sensation versus dull. So you'll have 2 feelings. Tell me when you feel the sharp, and then tell me when you feel the dull.
Sharp.
Okay.
Dull.
Okay. All right, so that was all for those. And then while I have you in this position, we will also do the, we already did it of those. So I have to do the reflexes though.
Okay.
Okay.
Should I stay sitting?
Yeah. So we're going to do the reflexes in her legs. So we'll do the patellar reflex. I use the point of this and it goes directly on the tendon. Okay, so it's a 2+ deep tendon reflex of the patellar. That's normal. Then we'll also do the one of the ankle on the Achilles tendon here. Goes directly on there. Okay, and that is also a 2+ deep tendon reflex. And we do that on both sides. And I'm going to check her, I'm going to palpate popliteal pulse, normal, regular rate and rhythm. I'm going to palpate the pedis pulse, and I'm palpating the tibia pulse, and normal rate and rhythm for both of those. Then I'm going to do the sensation on her lower extremities. So you tell me what sensation you feel.
Vibrating.
Okay, and when does it stop?
Stopped.
Okay, and then I'm going to do I'm going to touch something on your body. You tell me where you feel it. Keep your eyes closed.
On my leg.
Okay, and then I'm also going to, you tell me when you feel something sharp versus something dull.
Sharp. Dull.
Okay? So it's pain, vibration, sharp, dull. Okay. Okay, then I'm going to have you, so we'll do your posterior chest here. So first, I'll have you kind of turn sideways a little bit. Just face the other way.
Oh.
Okay, so I'm just looking at her back here looking at the spinous process here, it's straight, the muscles even on both sides. It's so bilaterally symmetric, muscles are well developed, and when she breathes, it is symmetrical movement. And then I'll do the thoracic expansion. So I'm placing, my thumbs are up, fingers are pointing lateral. Take a deep breath. All right, and my fingers move laterally, bilaterally, they move laterally, outward, bilaterally equal. I'm going to do the tactile fremitus here. Say 99.
99, 99,
And
99.
the fremitus is heard equal on both sides. That demonstrates lung density. Then I'm going to also percuss each intercostal rib area, indirect percussion. I'm going to do both sides and compare sides. And it's a resonant tone, hollow in quality, long in duration, and low in pitch. That's normal for the density of the lungs. Then I'm going to do percussion of the CVA. So that's indirect percussion. It goes in the costal-vertebral angle on each side. And it's also resonant tone, low in quality, low in pitch, and long in duration. Any pain in the flanks?
No.
Okay. Any pain or tenderness? There's no
No.
bulges. No
No.
bulges on your back. Okay. So then I'm going to auscultate the posterior thorax and lateral thorax in 10 spaces on the posterior thorax and 4 on each side. Deep breath. This is with the diaphragm of the stethoscope. And then 4 on each side. All right, and then no rales, cracking, or wheezing, normal breath or clear breath sounds. And then the vesicular breath sounds were heard in the periphery of the lungs. Bronchovesicular was in the center on each, more towards the top on each side of the spine. Okay, so, okay, let me think here. Okay, so I'm gonna have you lie down. Okay, and I'm gonna do check her jugular vein for distension. So I'm gonna have you turn your head that way. The head of the bed would be elevated anywhere from 30 to 90 degrees, however you can see the pulsation best, and I'm shining the light. I can see the pulsation, but I don't see the vein itself, so that's normal, no distension there. And then I'm looking, I would instruct her on how to do the self-breast exam. So for that, you would place the pillow under the shoulder, hand above your head there, yep. And you are going to want to use a gentle but firm circular motion of going around the breast with your fingertips, pads, just looking for any masses, pain, or anything that's not normally there, and you'll do both sides. Then I'm going to do her abdominal area. So it has a slightly sunken contour, and skin is a little bit lighter. It's intact, no open areas, no swelling. And I can see a slight pulsation in the upper midline. The umbilicus is midline. I'm going to have you take a deep breath and hold it. All right, the contour stays symmetrical. And then I'm going to look at it from the side eye level and from behind. And it is still symmetrical, and with each breath movement, it's symmetrical. And then I'm also going to listen for aorta bruis above the belly button with the bell of the stethoscope. And no vascular sounds, no bruis heard, that's normal. And then we'll auscultate all 4 quadrants of the abdomen, and in a systematical order. And I'm hearing gurgles and clicks about every 5 to 10 seconds, and they last anywhere from 1 to several seconds. That's normal. Normal active bowel sounds. And then we'll do light palpation. So I'm just using my finger pads, and I'm going a half inch to 1 inch in each quadrant. Any pain with that?
No.
No masses felt, no pain. Then we'll do deep palpation. I'm gonna put my hands on top of each other like this and go in 1.5 to 2.5 inches in each quadrant. Any pain?
No.
No pain with that? Okay. And no masses felt. Then I'm gonna do percussion in each quadrant. It's indirect percussion in each quadrant. And I'm not hearing any tympany, which would mean gas, and no dull tones, which could mean distended bladder. Okay, so then I'm going to move down to the inguinal area, and I'm palpating the femoral pulse. And you gotta go deep for that. It is a little bit more difficult to palpate, but it is palpable, regular rate and rhythm. The inguinal lymph nodes, there's a vertical chain and a horizontal chain. I'm not able to feel any lymph nodes or masses. Is there any pain there?
No.
Then if it was a male, I'd instruct on the testicle exam, and that is to do in the shower, do one testicle at a time, hold the testicle in between your thumb and your fingers, and then you will just feel for any masses, any pain, anything that's changed, and you'll do each testicle. Okay, then we're going to do range of motion of the hips. So I'm going to have you bend the knee and bring it to your chest. Okay, that's flexion with knee bent, and then flexion with knee straight all the way up. Okay, down. Any pain with that?
No.
Okay, and then I'm going to have you abduct it, so out like this, and then adduction back in. Any pain with that?
No.
Okay, and then internal rotation, bend your knee inwards, and then external rotation, place your heel on your knee and bend down. Any pain with those
No.
movements? Okay, and then run your heel down your tibial. That's done evenly and with coordination. And then I'm going to test the strength, so I'm going to have you lift your leg up, hold it straight, and I'm going to try and pull it down. She's able to withstand resistance, and the muscle is strong and equal. I would do it in both legs. And then I'm feeling her legs and her toes here. They're warm. There's no swelling. The skin is intact, and that's all good. There's no edema or anything. Okay, so then I'm going to. Okay, so I'm gonna have you stand up, and I'm gonna have you walk a little that way. Watching her gait, it's balanced, it's symmetrical. Okay, come back and then walk heel to toe. She's balanced while doing that as well. Then I'm going to have you walk on your toes and then walk on your heels. Okay, so that tests her muscle strength, and that's normal. And then I'm going to have you bend over, touch your toes. Spine is straight. The muscles are even on both sides. Any pain with that?
No.
Okay, and then I'm going to have you, so that was flexion. Then I'm going to do lateral flexion to the side, to the other side, and then rotation, and then hyperextension back. Any pain with any of those?
No.
Okay. All right. Okay, let's see. Did I forget anything? I did the pulses, aortic bruise. Okay.
Very good.
Okay, let's stop.